The Lavin Lift Strap has been designed in order to lift the lower portion of a patient's body in order to be able to change and clean them. An added feature of the Lavin Lift Strap is that it can be used for limb suspension. The leg typically requires another caregiver or puts strain on the caregiver due to its size and weight. This demonstration is of the suspension of one leg. The caregiver simply attaches the strap to the leg of the patient. In this demonstration, it is attached mid-calf. Once the strap has been secured to the leg, 2 strap adapters are required to attach the strap to the patient lift. Since the Lavin Lift Strap is a secure strap and not a sling, the patient's limb is able to be lifted higher if necessary without slippage. As with all of our processes using the Lavin Lift Strap, the caregiver does virtually no lifting. The limb being suspended should not be kept up longer than required for the prescribed treatment. Lavin lift straps should never be used for transport or restraint. Lavin Incorporated is providing general orientation and instruction regarding our products in this video. Upon request, we will be pleased to provide further information to healthcare providers, caregivers, and others interested in our products. Nothing in this or other Lavin Incorporated presentations should be construed as medical advice.